Hey, welcome back. We are here tonight, and like we said, I'm Dr. Todd Johnsonbaugh, Columbia Chiropractor, and with my son Roman. And like we were saying in prior episodes, when my kids get or family gets injured, you guys get a video. And today, Roman, what did you do, man?
I was snowboarding and hurt my neck.
Yes.
Yep.
He didn't catch an edge. What happened, man? You found it like you were flying down.
Little ditch, a little divot, and just kind of went over.
So what we were doing the examination, and then we were checking. It was going, yeah, I took my head. I hurt my neck. So I've done this before. I've snowboarding. I've taken a rear edge and fallen back and hit my head really hard. And I remember not being able to lift my head off the pillow. And I was thinking things like that. But then we were doing an exam on Roman. Roman, if you don't mind, go ahead and turn your back to the camera here and just sit on the other side here. We'll flip. And Mia, are we still in camera?
Yep,
are we still good? All right. So what we were doing is we were palpating through here, and on this right side it felt pretty clean. I could push in here, but when I got to the right side, right through here, I was bouncing off on that left side. So then I was like, wait, if I'm bouncing off here on the left side, but not on the right side, it felt pretty clean to me. What else was going on? I pushed down that shoulder blade, and on this side, he's wincing and not doing too good, versus on this side, he is doing really well. It pushes down real easy. You could even see it. It creases down on this side. On this side, he's fighting me. He's breathing right now. So then we go, okay, well, let's keep going. So we established these vertebrae are out of place. Thoracic vertebrae 4, 5, 4, 3, 2, and 1, all the way up. Then we say the ribs attaching. Let's check those. One was okay. 1 was okay. 2 is starting to get uncomfortable. 3 is really out of place. 4 not so good. 5 definitely not so good. Then we checked the shoulder blade. Remember that? And we said, oh, right there, that one's not going. So we gotta get the shoulder blade in place. We keep following the scapula on down, and then we get to the glenohumeral joint right here, that ball and socket joint. And when I push it this way, it does not wiggle as well, does not move as well as when I push this one in. Push back on it. Yeah, am I blocking the shot there?
No, you're good.
Okay. So let's start with the shoulder blade. So what happened was then when we were asking him about the mechanism, he said, yeah, I actually had to roll onto this shoulder. This side was hilled down and he ran into a rut, and then he took this shoulder. This shoulder hit, the impact came in through here. Shoulder blade went up like this, then irritated the ribs and eventually sprained his neck. Now the thing is, what he's complaining of is headaches. So when we really traced it back to its origin, we found this muscle right in through here, the tract that comes off of here, that comes to the base of the skull, right in through here, is really tight. And he'll tell you when I play with that right there. Mm-hmm. Do you feel that lump in there?
Yeah.
There's a lump there, versus on this side, it's not as lumpy. This side, you might even be able to see it if we zoom in on that I'm actually going twing, twing, and you can feel it moving. This side, not that way. So we want to get all this cleared first, and then we'll go from there. Rome, lie on your side. So the first maneuver we're going to do is decompress your shoulder. Real simple maneuver. Let me raise this up for you, son. Right like that. And all I do is I come here. This would be fun, because a lot of times you see the chiropractic adjustments. You don't see the muscle work that we sometimes do. I do probably more muscle work than a lot of folks do. But right now I'm just digging into his armpit to try to get his shoulder blade to come free a little bit. We've done other checks along the way to make sure it's safe to do this. But first thing I'm going to do is just take his shoulder blade, take him right on up, take him off my arm like that, and just lift him up there. And just decompress that shoulder. Kind of hurts, but at the same time feels good to be decompressed, right, Ram? Yeah. He's pretty solid. So it's at the end of the day, and I don't want to do this too long, but really important. What I see a lot on the videos is I see a lot of decompression of the head and pulling and adjustments called a ring dinger. Guys, have you ever seen the crazy chiropractic adjustments where people will pull the head really hard? It's an aggressive adjustment, and it can still have a lot of benefit. But what I don't see is a lot of decompressive maneuvers for shoulders that have been falling on, for hips, and there's a lot of areas that could be decompressed and helped. This is a gentle way to start to decompress the shoulder. My patients, I do this about a dozen or so times a day because my patients that sleep on their shoulder get this issue too. There, it's starting to finally relax. Good job. Let's do the first adjustment. Go ahead and lie on your back. So then that shoulder didn't get just pushed in this way, it got compressed also this way. So first we're going to take this and pull this down. So we just take here, go ahead and just relax for a second, Roman. And I'm just going to take the shoulder right in there and I'm pulling it out just a little bit. So I'm pulling out towards my elbow right here, and I just take a quick, there it goes. Let's see if there's anything left. Good. And it just moves really easy and glides really nice. Good. It's almost there. It's still compromised right through there. Good. Let's do this again, a muscle energy technique. So Roman, just gently push your elbow down against my shoulder. Good, and then relax. Nice. And push down again, and then relax. And then, like I said, gently, don't overpower it. There's no need for it. Just push, just real light. Because see, you're altering your shoulder mechanics. We're trying to keep it down. Push down, good, and then relax. And push down again, good, and relax. We're just trying to hold that position and push down again and relax. So this is another way to mobilize that shoulder. Get it nice and relaxed. Good. Now go ahead back on that side. Good. Let's see where we're at now. Good. Let's dig in there. Get that cleared out. Next we're going to do is take that shoulder, release some of the adhesions right in there. When he hit, he also bothered this area too. So go ahead and push against me and then relax. Good. And push against me and relax. Good job. All right, do me a favor. Straddle the table facing this way. So sit on up. Straddle the table. Nice. We're just going to stretch it out. Take this arm. Take this arm. And we're just going to stretch this out. Sometimes we get a little pop with these. Nice. Nope. Good. Good. Just nice mobilization there. Good job. I feel like we might be able to get some of the switch arms. All right, there we go. Sometimes you're able to get just a few of those to relax right there. Good. Nice. Good. All right, go ahead, lie on your back. Scoot down towards your feet just to drop. Nice. Doing great. Now we're going to get that shoulder blade to release a little bit more. So I'm going to come underneath him. My hand's underneath his shoulder blade here. My hand is on top. Good job, Mia. And I'm just pulling on down. And I'm pulling that shoulder blade towards me. Good. And I'm pulling that shoulder blade towards me and pushing that shoulder blade down into place. This does not feel good. Can we see Roman's face here, Mia?
Yep, we can.
He's doing good, but he'll tell you, doesn't feel terrific. But we're just going through it, trying to get this done tonight, so then he can resolve this issue by tomorrow. Good job. Then we're going to go ahead, take this. We're just going to take the first rib and the vertebrae. We're at that number 5 and push. And there, they just move just so easy. There was 2 or 3 right there because we loosened up everything else. There was another 2 or 3, and finally, anything left? There. Awesome. Now Room's gonna lie on. No, we're already getting there. Go ahead, sit on up, facing the camera there, Room. All right. So let's go back and check. So far, we got the shoulder. Okay, it's starting to move. He's getting there. Got the shoulder blade to calm down. We did. I'm back here. Ribs 5, 4. 3, 4 is still a little off, but I'm liking it. 3, 2, 1, pretty clear, but this muscle's pretty darn tight still, so let's get the trap to relax. So go ahead and just take your head and just pull over to this side. Good. And come on back. And pull this side again. And bring it on back. And pull onto the side again. Good. Now do me a favor. We're going to keep that shoulder blade down. Turn your head, keeping that good posture. Good. Turn your head and look down. Keeping your shoulder blade pulled down. Good. And you'll feel how we're really working the muscle attaches from here to there, that levator scap there. Good. Is that too much?
That's fine.
Good. And come on back. We'll do that on the opposite side. It won't be a problem. Turn and look down. Good. And now also side bend. Good. Come on back. All right. Now we're going to go up to the lowest lumbar vertebrae. Go ahead and lie on your stomach. Obviously, lowest cervical vertebrae. You're going to lie on your stomach. So one thing we can do, real nice, easy adjustment to do. Just come to the side here. We just take the head and just move it to the side, and you can see I can just push across here. Again, if you're not a licensed chiropractor, don't do this. I don't need a thing that needs to be said. This is for information only, but I'm just coming across. You can also see these two vertebrae here. My two fingers here are protecting you. And I just come right in there and just put that right back in. Good job, way to relax, Rowan. Let's see if anything needs to relax on this side. We could take this one while we're here, right there. And again, just take my fingers. No, that feels pretty good. I like that. You relaxed really well with that, Rowan. All right, let's see what's next. We're getting there. I'd like to see this a little. Yeah, this muscle's still a little bound up here, rhomboid. So while we're right here, we're just gonna take his arm, bring it across here, and just stretch out that rhomboid, and then compress it. And you can see I'm just bringing it right up to my thumb. Can they see that, Mia?
Mm-hmm.
It's a really fun technique. It doesn't feel great, but just again, just working that rhomboid out. Good. Coming back, nice. Let's see if anything else wants to move. We already got it to move while he was on the stomach. Let's see if anything else wants to come out. Now it's getting pretty, okay, now, it's getting back to normal. It's getting nice and pliable here. He's a young person, it should move really well. Just right here, maybe just a little bit. So I'll push up a little bit, see if that wants to move. Nah, nothing wanted to give. Go ahead, lie on your back. We'll finish up strong with neck adjustments. So we already did some neck adjustments, but he's having a headache, so we want to take a look. So we're going to work him, actually, where we find some issues still is right in the front of the neck. So we're just going to take this one right there. I'm actually trying to get that one to move too, so I'm going to just push that one over to my finger here, which will push it over to my finger over on the other side of his head. He'll relax this muscle back here, and then I'll just move right into place. Click. Real easy. And then finally, right up here, his head gets a little tight, so I'll actually be working on his head. Nice. Perfect. Gosh, how many adjustments did we get out of you tonight?
A lot.
A lot.
At least like 5 or 6.
Yeah, I would say so, because when we ran your stomach, remember you're on, well, first you were on your back giving yourself a hug. That was like 3 there. Then you were on your stomach, and we did that one with your neck. That was 4. Then we just did one up at the top, and then another one right at the very top. Yeah, gosh, about half a dozen just there.
Yeah.
Plus the shoulder, and then plus the scapula. There's a lot going on. Lots of fun here. Now we're just doing a little release here. Rum's got a headache. I don't think he hit his skull here, but remember we got all these little areas right in here where the skull bones meet the sutures. So I'm just going to do some gentle pressure point work on him, some gentle with cranial sacral. This is a great way to end. It'll calm him. Now we're going to make sure he does his homework. Now, first thing, Roman's knows already what posture to maintain. But Roman, can you tell folks out there what posture they're supposed to do?
Yeah, shoulders back, neck not not your head sticking forward, nice neutral position.
Right, and pull back.
Yeah.
That's going to be really important. So all his range of motion that he does, he's going to make sure his shoulder blades are down and his head is in neutral. So when he does his gentle range of motion, or then eventually gets to some strengthening, he does it with those two things in mind. And that's going to be really important as we're finishing up here with the nice cranial sacral work. Feels good. Roman, isn't this a stark contrast to how we began with all the deep tissue? Yeah. So what we did today was we started off with an assessment. We started off where we thought we were going to begin. We started off at the head with our assessment, but then we kind of worked our way down and we realized it was more complicated than that. So we actually had to start the treatment way out in the shoulder and work back in. And then once we got back in, the adjustments, they went actually pretty easy. Not bad for somebody that was spasming like that. Yeah. So he did great. So Roman, thanks for your help tonight. We'll let you all check in with Roman tomorrow, see how he's doing. But I bet you already, the kids usually heal up real fast. So anyways, thanks. Again, this is Todd Johnsonbaugh from our basement. Hey, if you like this comment, please make sure you like, subscribe, the alerts, right? Hit the
Turn
alerts.
on notifications.
Yeah, and definitely comment on what content you'd like to see future videos. Take care until we see you next time.